So I briefly touched on this last time, but let's talk a little bit about COVID vaccines and RFK doing RFK things and removing a recommendation for COVID vaccines for kids and people who are pregnant. Now, I won't get into the children part because I am not a pediatrician, but I can say that neither of these was based on any kind of strong evidence, and it is a problem for a whole lot of reasons. And I can get into like the medical discussion of COVID and pregnancy, absolutely. But one thing I do want to say is part of the big problem with this is like some people are saying, oh, why does it even matter? It's not a recommended vaccine anymore, but if you want it, you can still get it. Well, yeah, but insurance coverage typically comes from recommended vaccines. So if they remove it from the CDC recommendation schedule, you're not going to be able to be vaccinated without paying out of pocket, which will be incredibly expensive in the US where healthcare rates are out of control. So this will take it out of being a free vaccine for people who are unfunded, and it will take it out of being a funded vaccine for people who are insured. So that is in and of itself an issue. And that's before you even get into the fact that this was done with really no data to back it up. I'm going through an NPR article right now that's talking about it, and let's see what they have to say. So he said, this has been a couple of weeks now, but that he's happy to report that the CDC removed that from the immunization schedule and that it will be much harder for parents to get their children vaccinated and for pregnant people to get shots because insurance companies will no longer pay for them. I haven't read this, but as I said, last year, administration urged healthy children to get yet another COVID shot despite lack of any clinical data to support the repeat booster strategy in children. That's not really an accurate statement, but again, I'm not going to get into the kid part. They said it's common sense, it's good science. So they're talking all about kids in this press meeting, and they don't really get into as much the pregnancy side, which is where I tend to have a bigger issue with this because it's a big deal regardless. But we know pregnancy is a risk factor for having really serious long-term complications from COVID or any upper respiratory illness, especially COVID, and flu is the same. And we also know that people who are pregnant are more likely to be exposed and end up in the hospital if they get COVID. So long-term bad outcomes, death, hospitalization, all very expensive and dangerous things for your pregnant people in your life are more likely in this patient population. And we also know that the vaccine decreases how often any of those things happen. So just for me personally to, go a little bit into anecdote territory. In just a 2-month period during the Delta wave of COVID when I was working in Texas, I had 3 patients who were pregnant who ended up intubated on a ventilator and never woke up. 3. Most of us as obstetricians will see 0 or 1 maternal deaths in developed nations in our entire career. And in 2 months of Delta COVID, 3. That, if anything, tells you that this is a more dangerous upper respiratory illness than a cold, particularly in pregnant people. Like, that should be it. And that's an anecdote. But the data also says this. So we know that COVID is very dangerous in pregnancy, and people who are pregnant have a tendency to get worse lung complications related to it and long-term issues. Anyway, so I take issue with this, and I take issue with the fact that it's being done without any science to back it up. This is just, knock things off because I don't like them. This is why you don't put anti-vaccine people in charge of health decisions for the United States government. So let's see what other people have to say about it. Health and Human Services and CDC remain committed to ensuring the health and well-being of all Americans, especially our nation's children. Since the vaccines became available, the government's been recommending shots for everyone. And I don't disagree. Like, we can review who needs them and how often and all of those things, but it's just like you review the data first, and then you have like scientific reasoning when you take things off of a recommendation. Even the press briefing was just like, it's just all over the place. And then another thing with people who are pregnant. Okay, so even if we ignore the pregnancy complications, those newborns also need the passive antibodies that come through from vaccine to the person who's pregnant, go through the placenta, protect the newborn when it comes out. That is also really important. So you're not only putting the person who's pregnant at an increased risk, which during the entirety of the pregnancy puts the baby at a risk, you're also putting that newborn at a disadvantage because it doesn't get passive immunity from the vaccine that was given during pregnancy. And that's why we vaccinate for things like diphtheria, tetanus, diphtheria, pertussis, but mainly it's for the pertussis part of that during pregnancy, because we need people to be protected from getting pertussis if they're going to be around a newborn. So sometimes we vaccinate people to protect the people around them who need more kind of insulation to give them a better chance of either not getting sick or getting less sick. Is there any logic behind the decision, or is it, I haven't been able to find any real logic. They can masquerade as though they have logic, but I don't see any real science backing this up. And importantly, ACOG, American College of OB/GYN, has come out and said that they are completely against this. They still think people who are pregnant should be vaccinated and that it's incredibly important both for during the pregnancy and what we were just talking about with passive immunity. And every national organization around the world in developed nations maintains the recommendation to be vaccinated against COVID. So this is like an exclusively US thing that has no real science basis and puts people at risk. It's disgusting and horrible. And it is truly just a move from the anti-vaccine community who's now in charge of health decisions in the US. So the comment from the president of ACOG is, as OB/GYNs who treat patients every day, we have seen firsthand how dangerous COVID infection can be during pregnancy and for newborns who depend on maternal antibodies from the vaccine for protection, he said in a statement. The science has not changed. It's very clear that COVID infection during pregnancy can be catastrophic and lead to major disability. Yeah, I hadn't actually read that, but that's almost exactly what I said word for word, so I should have just skipped it and posted, what ACOG was saying.